Hello from exciting St. Louis. Today, I want to talk to you about a topic that has been causing a lot of stir and controversy, and that is harm reduction. Harm reduction has been in the news and in the forefront for the last several years, and it has taken a life of its own. So let's break it down. What exactly is harm reduction? Why is it so controversial? And why the backlash against harm reduction in our field? Harm reduction is not new. We have always attempted to mitigate or lessen the harm from any substance that can cause damage or harm to the patient. We have seen that over the years. For instance, when people are drinking distilled spirits like vodka, gin, or whiskey, they try to reduce the harm by encouraging patients to drink beer, not knowing that actually beer, which contains lesser percentage of alcohol, can be of help. And there are so many examples. We also, even the most standard treatment of treating opioid addiction with substitution treatment with the methadone or buprenorphine is a form of harm reduction. But there's nothing new about it. Most of us can remember the very popular and controversial harm reduction measures in smoking. They came up with a way to reduce the harm from cigarettes by offering what are called filtered cigarettes. And they were supposed to really protect the patient, allow them to enjoy smoking, enjoy the pleasures of nicotine without the harm caused by nicotine. We all know that did not work, but it was a big selling point. Then they came up with low-tar cigarettes. So all these are measures that really are not an end in themselves. They are measures that sometimes give people a little bit of pause, a little bit of consolation that they're not doing as much harm to them. But what is important to know here is that cannot be the end. It cannot be the ultimate solution for the problem. If you're smoking filtered cigarettes, that's one step, but the goal has to be to quit cigarettes. Same thing with drinking beer. So you don't stop at just drinking beer for the rest of your life. You get off the distilled spirits and ultimately taper off from beer, and you're not drinking anything. So harm reduction started in our field in the 1980s when AIDS became a big issue. We had patients who were injecting, using and sharing needles, and that was a major cause of transmission of the HIV, the AIDS virus, among drug users. So something had to be done. A desperate, urgent measure had to be promulgated. And they came up with a way. They started off telling people how to clean the needles, and they started encouraging them to use Clorox, a chlorine solution, to clean the needles before they inject. And that made a lot of sense because you have to protect the patients from blood-borne diseases like AIDS, HIV, hepatitis, and so on. That made sense. But over a period of time, it took on a life of its own. And then they said, okay, it makes sense, instead of teaching them how to clean the needles, let's just give them fresh syringes. And that made sense. And then they went on to other measures were taken. For instance, nowadays, harm reduction in the context of opiate use are really three things: the widespread distribution of Narcan, giving out fentanyl test strips to make sure that the drugs they are using is not laced or contaminated with fentanyl. They can test the sample before they use. And the third, obviously, is syringes. And that has taken a life of its own. And for many people, it has become the end all. That's a new treatment. That's where the controversy comes. So with all these measures, why do we still have such a high incidence of opioid overdoses? Yes, we have to acknowledge that we have made some dent in the number of people that we were losing to opioid overdoses. They have come down from 110,000 down to about 80,000 or 85,000. This is very commendable, but we cannot stop there. And we are not quite sure what led to this. Is it the widespread distribution of Narcan? Is it offering people treatment options? Is it because the supplies has been interrupted? Or is it because the pool of people using drugs has shrunk? We are not sure what causes it. But we have to keep in mind that harm reduction cannot be the new treatment. When I give talks, I often ask my audience, Tell me the limitation of Narcan, and hardly anybody knows the right answer. Narcan is a fantastic medication, but it has three major limitations. It can only be given after an overdose. Secondly, only by a person other than the patient. And thirdly, it lasts for only about 30 to 45 minutes. So these limitations have to be taken into consideration. Now you see that the federal government has come down very heavily against harm reduction as a form of treatment, and to the point that we are even reluctant to use the word harm reduction. So people in jest call it harm mitigation or things of that sort. So what can be done? Yes, we need to continue this, but also give patients the information, the hope that they can get well. For instance, in Missouri, the treatment for any addiction is free, yet they are not aware of it. Where we have an issue with some of the people who promote harm reduction as a standalone way of helping people is not giving information to people to whom they distribute the syringes or whom they distribute Narcan. I think it is unethical and in many ways irresponsible for these people not educating or giving hope to them. We are not talking about forcing them into treatment, giving them treatment options. How many people, homeless people, people on the streets or using drugs, are aware that treatment can be free? You can walk into a clinic like the clinic that ARCA runs here in St. Louis without a penny in your pocket. Now, could that be considered unethical? I don't think so. But so many times people say, no, telling people about treatment is not what we believe in. That's not part of harm reduction. I vehemently disagree with that notion. You have to have people be aware of it. They may not come for treatment right away. It may take weeks or months. But once you plant the seed, you never know how that can take root or it can germinate in the patient's thinking. And they say, hey, let me come here. And they are surprised when they come here that the treatment is free. They are treated with dignity. They are treated with respect. And they're given options, not just with treatment, but also with housing and other services. So I want to put harm reduction in perspective. Harm reduction cannot be a standalone form of service. It has to be combined with educational opportunities, educating people about treatment options. Because many people still continue to believe that addiction to opioids and alcohol is an incurable disease. And they have lost hope. So all we are doing is attempting to palliate the symptoms and keeping them alive. That is commendable, but it cannot be the end all. So I hope this generates an interest in people who listen to this podcast, and I would love to get your feedback and comments, because we cannot just rest on our laurels saying that, we have seen a 25% drop in opiate overdoses. But on the other hand, look at the problem we have with alcoholism, that we lost 178,000 people to alcoholism. I hope you have a wonderful weekend, and let's keep in touch.